The following segment sponsored by Tulsa Integrated Health. Do you ever have an unexplained numbness, tingling, or burning? You might have a nerve problem or neuropathy, and the experts at Tulsa Integrated Health, the Neuropathy Correction Center, want to help you out. So we welcome Dr. Bill Lewis today of Tulsa Integrated Health this morning. How are you doing?
I'm doing great, Erin. Thanks.
A lot of people suffer from this. We see commercials on it all the time, so I'm assuming that this is a big problem in America. So what are some of the causes of it?
Typically what we see in our office is things like diabetes, cardiovascular disease, chemotherapy, even certain medications and toxins like Agent Orange that some of our veterans were exposed to.
Okay, and what are some of the symptoms of neuropathy? We touched on them a bit.
Yeah, typically it's numbness, tingling, pain, burning, freezing, deep stabbing pain, but really it's the balance problems that affect a lot of people, because when the nerves to the legs and feet don't work right, it starts to affect our balance, and so that can be very dangerous.
Yeah, and is it on and off pain, or is it chronic?
Well, typically it starts as acute, and so it'll be intermittent, comes and goes. It's not there all the time, but as it progresses, which it always does, and it doesn't fix itself, then it becomes constant.
Okay, and what are some of the treatments that you offer for that?
So typically, we want to correct it. We want to reverse it. We don't want to be treating people over and over again for the rest of their life. Most of the time, people are getting drugs or injections or surgeries, and it's just not working.
Kind of a constant battle.
Yeah, so we try to reverse it. So we want to stimulate the nerves to grow, and similar to a plant. If a plant's dying, what would we want to give it? Water, sunlight, nutrition. So we do the same thing for nerves. It's growing living tissue. So we give stimulation to the nerves to grow. But then there's blood vessels that feed the nerves with blood. So we want to make sure we're healing up any blood vessel damage that's caused by diabetes or chemotherapy. And then finally, nutrients and supplementation. We utilize some state-of-the-art nutrients and supplements revolving around a Nobel Prize winning concept.
So this is a non-invasive approach.
Absolutely.
And if you said that this is something you don't want the patients to keep coming back to, how often or how long would these treatments last?
It depends. An average case of neuropathy, there's two different answers to that, because the healing time can take a while, because we're talking about a chronic problem that can have been present for years and years and years. But most people start to feel better within just 1 or 2 weeks.
Nice. Is everyone a candidate?
No. Unfortunately, just like that plant analogy, if a plant's dying and it gets to the point of no return, no amount of nutrients or sunlight or water is going to bring it back. So nerves are the same way. If it's too late, the nerves are dead, and that leads to permanent impairment, disability, wheelchair, things like amputations.
Okay, so it's good to get on it if you're having these symptoms.
That's right.
To try and correct it for the future.
For sure.
All right. Thank you very much. Let's get the information on the screen. If this sounds like you think you'd be a good candidate, want to talk to Dr. Lewis a little bit more, Tulsa Integrated Health, 6949 East 71st Street, 918-392-0742, tulsaneuropathy.com, also on Facebook.